Welcome to the Mamatoosa podcast. I'm your host, Atusa Benji. So welcome, Amber.
Thank you, Reem.
It is so good to see you again, and welcome to the Mamatoosa podcast.
Yes.
I am just so excited to see your face and to talk to you about your motherhood journey. I had the privilege of being at your birth and being your midwife and watching you in pregnancy in the early postpartum weeks. And we've been in touch here and there. And I was really excited to have you on because you definitely had a plan B, went to plan C, sort of went to plan D experience.
All the way to Z.
All,
yeah.
all the way to
the
Z
alphabet.
experience, right? Really in the thick of it. And now your baby girl is almost 3.
Yeah.
And so it's been many days and many weeks since those early days, since the birth. And like I always say, the day of the birth is the birth of the baby, but it's also a birth of the mommy. It's a birth of a new woman when the baby came out.
Yeah.
And so I really would love to hear about the choices that you made in that early pregnancy to have an out of hospital birth, your pregnancy, your delivery, some of those challenges, and looking back on it now, what have you deemed was what has come to you in this rebirth is really what I want to hear. So the floor is yours, my friend.
Oh man, what hasn't come to me in this rebirth? I tell you. Well, yeah, I guess we can just start with I was a home birth. My mom had me at home, 1989, 6 hours. What a champion. You know, everything went smoothly, the ideal situation. So I never really imagined, you know, when I would think about like having a baby, I never really imagined it being in a hospital. It was always just kind of a given. I ended up choosing a birth center specifically because I knew I don't want to give birth in my thin-walled apartment in LA with my neighbors on each side, listening to the most intimate labor sounds. Like, no, that was not going to happen. Especially, you know, when I was laboring at home, I was like, felt nice to like pound on the wall, and I was like, we got to get out of here. Like, I do not want to be here. And then also I knew that we would be leaving that home fairly soon after Teddy was born. So I knew it was already going to be difficult for me to leave a home that I, you know, brought a child into and raised her in her first, you know, year or so. And I didn't want to have to also part with a place where I like physically gave birth. You know, that was just like too much for me. So yeah, I found Graceful and it was perfect. I was like, this is the one. I birth center, like, this is great. I had my first few appointments with like a general OB because she was a little surprise. My little surprise child. Yeah, so I just kind of like went there first to get checked out and then found the birth center pretty soon after. Yeah, and it was just a really good fit.
I love that you say that about your decision why to not have your baby at home, because there are so many reasons people don't want to have a baby in the hospital but don't want to have a baby at home. And I love the way you articulated. I think some of the power of home birth is that you birth in that space and then you stay in that space and you raise the child in that space.
Exactly.
And I love how you talk about you almost didn't feel an attachment to the space. And so you didn't want to bring your baby into this temporary home, only to have to leave a very powerful experience behind there. And I love that. I've never heard it put like that. So how beautiful.
Yeah, thanks. I'm a really, what's the word? Borderline hoarder. You know, I collect things and, you know, places matter and experiences like really matter. So I just knew it was going to be too hard. Yeah. And with a space I was intentionally not getting too attached to. And that was just kind of like that magnetic opposite.
I love that. That's very powerful. Thank you.
Yeah. I also, you know, have a really supportive community around me. You know, like I said, born at home. So my mom was my doula, full support of my choices. Shane, my partner, Teddy's father, whatever you want. You know, if you think that's the place that you're going to feel the safest and most comfortable, then like, great, let's do that. So he's always been supportive of everything along the way. So, you know, and I checked in. I was like, is this comfortable for you? You know, this is your experience as well. And he likes to try new things. So he was totally down, which was awesome. I didn't have to do any convincing there.
So you found a good fit with the midwives and you
Yeah.
had a good pregnancy.
Yeah, pregnancy was actually really great. It was kind of, you know, I was super nauseated the whole morning sickness and everything. But that past like day of second trimester, the clouds parted and
The sun came out.
shone
The
and
sun
everything.
came
Yeah,
out.
sun came
Yeah.
out.
And you worked until almost the very end, I remember.
Yeah, I worked a little over a month. I can't remember month before I delivered. I can't remember if it was you or Michelle. Maybe it was Heba, but it was either you or Michelle that said like, you get a certain amount of money and you don't get that money back. Like, don't be a hero. Start your maternity leave, collect all of your maternity leave money,
Right.
and just put your feet up. And it was kind of stressful because we had moved into this new space and it was chaotic. And one of my friends, bless her heart, came over and just completely organized and put things together and just like handled it. She is Monica from Friends. I was so grateful that she like gave us a space to bring the child into.
It's powerful.
So yeah, that's, you know, an example of the super supportive community around me, which absolutely matters. You know, you don't want to have to defend your choices to anyone, which you will do so often along the way.
It's so, I often say, and my listeners will hear me say this over and over again, is people are so judgmental of birth choices. So what, you're having a baby at home? What, you're having a baby in a hospital? What, you're doing this? Are you doing that? You're breastfeeding? You're not breastfeeding? And then they sort of forget that you will then be making hundreds of thousands of choices for this child that go way beyond the birth and the postpartum period. That you will actually have absolutely no say. No one will listen to you. No one will care. It's not up to you. It's not your child. But somehow when it comes to birth and breastfeeding especially, there's all this judgment of how it has to be done. Yeah. I mean, you wouldn't tell someone, typically people don't say like, when you teach multiplication to your child, do it this way. Unless you seek an expert about teaching math to a child.
Right. Right.
But when it comes to the birth, everybody seems to have an opinion and a very strong judgment of what's dangerous, what's right, what's ethical, what's moral for you and the baby. And you can really start your pregnancy feeling very unsupported. So I love that you were already in a community where your choices were honored and normalized.
Yeah.
And your mommy is a fantastic doula, by the way.
Oh, thank you. I'll tell you said so. She is an amazing Mima. She's killing it, little
I
Mima.
love it. What does she call her?
Mima.
Mima. That is the
We were trying for Gran, and we'd say, Teddy, can you say Gran? And she'd go, Mima. And let me tell you, you brought up making choices. I don't make nearly as many choices as I thought. That kid makes all the choices.
Right? Right. And we forget that babies have a choice in their birth too.
Yeah. And she tried and true, man. She is exactly, you cannot get that kid to do something she doesn't want to do. And it's like past toddler stuff. I mean, literally has been this way since birth. No means no. And that is a tough, I mean, we can get into that in the motherhood phase, but you know, it's true. It starts at birth, and to try and listen to all this advice and please everybody, which you shouldn't do anyway, or strive not to do, but you don't really have a choice because it all depends on what your kid needs, on what your baby needs. Like, she was not budging, you know? to come out, and she is still that way.
And she was a very strong newborn too. I remember she had a very strong constitution. Small baby, but solid. So you went into labor. I remember you went a few days over your due date, right?
Yes, I was a week and a day, I believe.
That's exactly, quote, not that you're average, but that is exactly what Harvard says is the average for a first-time mama, 41 weeks and 1 day. So normal, normal.
Yeah, I think she could have cooked a little longer. I think she probably maybe had like a day or two left. I don't know why I feel that way, but just knowing her personality now, I'm like, I also think that I was maybe miss my due date was maybe incorrect from the
Right.
original hospital.
Yeah.
I
Yeah.
think I maybe conceived like a week later.
Could be.
So that could have been like week 40, you know. But yeah, I had two cervical sweeps. And it was that night of the second one is when I was like, gosh, it just feels like I have cramps. Like, this is so annoying. Yeah, I guess I'll eat a little bit. Okay, it's not really going away. And everyone seemed, my mom was already down, and her and Shane were getting ready for bed. And I just kind of like kept casually complaining. And my mom was like, and her and Shane shared a look, and they're like, I think this is it. I think
We're
it's
on.
happening.
Yeah.
And I was like, no, I have to, no. And then like quickly, once we kind of named it, it came on.
Labor declared itself.
Yes, I am here. Hear me roar. So I like got, my record on the record player and like turned on my twinkly lights. I was like, okay, guys, it's go time, and got everything all settled. And then it just, we were timing my contractions, and then all of a sudden they were like really painful and very close together. And I remember calling you, and you guys were like, okay, like still early, it's fine. Once we get to like 12:30, let's check in. And then I think like, and you don't know, like my mom was like, call again. You should call again and ask. And I was like, no, it's fine. Like, this is what they said. We're kind of like running around with the chickens with their head cut off kind of thing. Still like a calm, chill atmosphere, but it's all new. So yeah, we got in the car, got to the birth center, and everything just kind of took off from there. Man, my mom packed the best snacks still to this day, packing the best snacks. They kept me hydrated. That's another thing, in the hospital, you're not allowed to eat. You're not allowed to drink anything. You're running the hardest marathon of your life, and you're not allowed to nourish your body. It's just like wild.
Mm-hmm.
So I had bone broth and coconut water and watermelon juice, which I accidentally had, during labor while it was warm. And I don't know if I can ever if I can ever have watermelon juice again, because that was just terrible. But yeah, we tried all kinds of things. I got in the shower, and we had the ball and the rope, and yeah, she just wasn't budging. And then you guys broke my water, which actually I remember thinking from like a distance was like kind of cool in a way. For some reason I was like, whoa, just like that feeling of whoosh.
Sometimes breaking the water can help to bring the baby's head down. So the baby puts more pressure on the cervix, and it helps with dilation.
It totally did. I remember you guys were great. You and Michelle were great. Answered all of my questions. I remember I was like, okay, well, we can break your water. That will, push you into maybe some harder labor, but it shouldn't last as long. And I was like, okay, so either it hurts like this right now for longer, or it'll hurt a little worse for shorter. And I remember you going, yes, exactly. And I was like, break it. Let's go. Let's do it.
And you were already well into active labor at that point.
Yeah, I feel like I spent the majority of my labor in like the heavy duty active part of it. But, I had a lot of people, oh, just get the epidural. Just go to the hospital and get the epidural. Don't be a hero. While labor is absolutely excruciating, let's not, sugarcoat that. I was so, and, still am so happy to discover what my body could do and feel that water breaking and feel that like cool whoosh kind of feeling and really get to like fully experience it to my, you know, best ability, I guess, to
In the
my
most trusting environment with a loving mother who's a
absolutely.
doula, with a partner who's
Yes.
open, and with midwives
Yeah.
who are inherently in that setting. So what a cushion of support.
It was such a cushion, and you guys, you know, left us to it. We were alone for most of it, and not scary alone, but like peaceful community alone. You know, you guys were right outside, so it was like intimate, like a home birth or free birth would be, but I had that support literally on the other side of the wall. Calmness, the demeanor, the warmth. You know, I feel, well, I know that you don't get that kind of warmth. I didn't get that kind of warmth once, you know, we went to Plan B. So, yeah, it started out just the best. I was in like a little lion's den cave and everything was cool. I had no concept of time. You know, it was magical for a while there. And I did get to see her head. I remember starting to like feel like I needed to push while in the tub. In true to form, I did not like the tub. I didn't think I was going to. I was willing to try anything, but I was like, I don't like that half immersed tepid water feeling. I was like, get me out. Um, but yeah, so then I remember, and I'd love to hear your little points of what you remember as well. But I remember her heart rate dropped in the tub. And so we got me out to get in a different position and try different things. And I remember you guys complimenting how strong I was at pushing, even though it didn't feel like anything was happening. I believe it was you that got me the mirror so I could see and have that visual connection of like, look, like there's the head. And, you know, we didn't know what gender she was at the time. So it was, look, there's its head, you know, like you're doing it, it's happening. So,
And to be clear for the listener, so Amber
yeah,
was now fully dilated and
yeah.
pushing the baby down the birth canal. And baby was playing that peekaboo as babies do, where their
Mhm.
head shows and then it sort of goes back up and then it comes down and then it goes back up. And sometimes bringing a mirror for the client to see the progress is very, very helpful. Now, some clients are like, absolutely not. I don't want to see. Take the mirror away. I'm not interested. And other clients are like, whoa, there's really a baby that I'm pushing out. So it can be very, very helpful.
Yeah, and I remember you bringing that up in one of our appointments. Like, you seem like a really visual person. You were just always so in tune with me. It was so great. You noticed that I was a really visual person. You were like, I think a mirror would be really helpful for you in birth. And I was so great. Okay. So yeah, I got to see the top of her head, which was really nice. But then she wasn't coming and the heart rate dropped and we had to make a call, both a judgment call and a phone call. So yeah, you, I believe, called 911. I know my mom has said multiple times how much she loved your delivery on that when you came in and said, okay, 911 has been called, just very calm, matter of fact. Yeah, she appreciated that connection right then.
Yeah, it's hard. It's hard when 911's been called for your daughter.
Yeah.
And that wasn't anything that you've experienced or anything that you were experiencing, anything you were anticipating, other than this glorious twinkly light out of hospital setting in the lion's den, right? And to be clear, Teddy's heart rate would go way down and then it would recover. And then it would go way down and it would recover.
Yeah.
The question at that point is, how long do we continue to push on her reserves before she actually comes out into the world?
Yeah.
And I made the call because I thought this progress is very, very slow. Amber's been pushing for a while now. And I'm in an out of hospital setting where I don't push any envelopes. So if you're pushing, you could push for 4 or 5 hours in an out of hospital setting without an epidural, so long as there's progress.
Mm-hmm.
But if there's not progress where the baby is like lower and lower and lower, even if it's a millimeter at a time, but from what I could see, something was holding her up. Something
Yeah.
was holding her up. And now her reserves were going to start getting depleted. So how far did I want to push before, and have you push, before we could have gotten her out vaginally, but at what cost?
Right.
At what cost to you and at what cost to her? And with no timing of, okay, this is looking imminent. So
Right.
that's where the call was made.
Well, and I have to say it was a good call because I got to the hospital with I want to call them with the boys and the EMT boys because they were boys. They were so sweet. They were so sweet. They tried to take me to the children's hospital. Bless their heart. And they were like, we can't take her there. She's not a children. I was like full labor trauma being like, this is fine. You're going to be okay. And I hear them say, she's not a children. And I was like, oh,
Oh my
okay,
goodness. And this was at
that's
a time
fine.
where I couldn't come with you. Your partner could go with you, but COVID was intense. And we talked about this in
Yeah.
another podcast where it seemed like daily the policies would change.
Yeah.
So you can come, you can't come. So midwives were not accompanying our clients in. So, and it was hard for us because we would send off a family in an ambulance to go to the hospital to collaborating care, to collaborative physician care, and have no idea what was going on with them, which really sucked in that period being an out of
Yeah.
hospital midwife.
We needed you, you know, like us mamas like needed our midwives because of the terrible treatment we got. Shane's scared out of his mind. This is all new. One of the paramedics was really great. He made sure I was covered before I got out and he stuck with me and was like, are you okay? Like, I'm going to leave now. You know, he was really great. So I appreciated that. And then I was in the emergency room for 2 hours before they finally were like, oh, we need to prep you for surgery. So I wonder what would have happened if, you know, you waited 2 hours. Would she have come? They told me not to push because my cervix wasn't dilated enough anymore. It was just like the weirdest thing. And then they're trying to get me to wear a mask because of COVID. I'm like, you know what, 17 to 20 hours deep in labor. Like, I'm not putting on a mask. Like, I need air.
And Shane was downstairs getting COVID tested or something, right? He wasn't even allowed to come in with you.
He was able to come in with me and stay with me, but they did take him to go get tested, and I was completely alone in that room for I don't know how long because time was nothing to me anymore.
Right. And cervixes are dynamic. So sometimes you will, check a client and they'll be 9 centimeters and there might be a little bit of cervical swelling. And then in a couple hours, it could actually have gotten more swollen and become
Yeah.
closer to 7.5 centimeters. So cervixes are dynamic. And I think that's something that people need to sort of wrap their head around is that between getting in an ambulance from a birth center setting with confusion about which hospital to go to, then getting to the hospital ER, your cervix changed.
Yeah,
And it
yeah.
wasn't until I think you told me the doctor came in about 2 hours later and was like, oh my God, this baby's really having D cells. And you were like,
Yes.
really? Like, why did you think I was transferred?
Why do you
This
think
was
I
not
would
my
come
plan.
here?
Right.
Yeah. Yeah, he finally came in and was like, oh yeah, the heart rate's really low, blah, blah, blah. Do you want to keep trying? And I was like, like in my mind, like I'm here to have a surgery because I couldn't do it vaginally at, the birth center.
Yeah, I'm
So
here
like,
for an intervention.
yeah, what do you mean do I want to keep trying? Like, what? And I, said like, I'm trying not to have an epidural, but like this is getting real rough. And the hospital staff, the ER staff would hear that I came transferred from a birth center and they would look at each other. This happened multiple times. They'd look at each other and roll their eyes and go, oh, no wonder.
Empowerment at its best, right?
Yeah, like, I don't care about your opinions. I am a patient and you need to take care of me. Like, I'm scared. I'm in labor. Like, something is obviously wrong. And you have no idea. You have no idea what happened yet. Like, you've just walked in the room. Like, it's not like going to a birth center inherently means that there's going to be a problem. You know what I mean? Like, You don't know what happened yet.
And that's the stigma is not only based in just inherent stigma between, doctors and non-doctors, but the lack of education in exactly what a birth center is and what a midwife does and what the scope of practice of a midwife is, which is we talk about this a lot in the podcast and on my educational platform, which is a licensed midwife in this state in California has the scope of practice of taking care of the pregnant person for 9 months, including blood draws and making sure ultrasounds are done on time and checking the cervix and providing prenatal care, catching the baby and then providing postpartum care and carrying drugs and having the scope of practice to administer those drugs in an emergency setting, being able to manage a full code with a baby who needs resuscitation. And I have dear, dear, close, beloved friends who are in the healthcare facility, in the healthcare world, and they're like, really? I didn't know you did that. I didn't know. I had no idea. I thought it was just a person with not just a person, but a person with a doula in a room is really what they're thinking, with no access to IV fluids or IV administered meds or knowledge of how to do life-saving techniques in the obstetrical setting. Yeah, none whatsoever. And granted, we don't do surgeries. We don't do vacuum deliveries. We can do episiotomies. We don't usually need to do episiotomies, but we can. We don't do forceps deliveries. Those are instrumental surgical deliveries that are done by surgeons. But midwives all around the world do a pretty good job of managing low-risk birth and being able to identify when it's time to go. Like, when do I now need to get a surgeon involved? And I think that's just missing from the eye roll is partly from indoctrination and partly from lack of education.
Absolutely.
Because there's no course that you take in medical school or nursing school that says, oh, home birth 101. Let's talk about midwives around the world. It doesn't happen. It's not, we don't care. It's not us. Why are we even talking about this?
Which is so funny because how do you think we all got here in the first place? A woman, a pack of women delivering a child at home.
Correct.
In a barn,
Correct. And some of them had mad skills too. Some of the stories I hear from grandmothers and great-grandmothers and great-great-grandmothers of midwives who had this amazing skill set of how to get a breech baby out, how to deliver a baby who's coming out with a hand, what to do when a foot comes out of the vagina instead of a head. These women were trained by women before them, and many had hand skills and clinical skills that were beyond a lot of our doctors, nurses, and midwives now.
Absolutely. Okay, I have to do a shameless plug. Is that what it's called? I don't know. This book I read, I have to please put this book out here. Frozen River. I might butcher her name. I think it's Ariel Lawhan, Lawhan, something like that. Frozen River. I'm a huge history nerd, so I read a lot of historical fiction, but she is, I think, like the great-grandmother or something of Clara Barton, who started the Red Cross. And it's just an awesome story, but she was a celebrated midwife who delivered hundreds and hundreds of babies, only lost like 2 mothers along the way, something like that. It's very empowering.
The Frozen River by Ariel Lawhan, Lawhon. Yeah, and when you read that, the history or historical fiction based on history, you can really see that these people had these crazy skills because they had to. Those were evolved over time. They were not taught out of a medical journal or a medical school or a medical professor. And while thank you God for doctors and technology and modern medicine and surgery and sterile technique and all of those, it has its place. But the eye roll is detrimental.
Just this lack of compassion. Yeah, and then once I got into the operating room, I asked, for delay. I'm like still hanging on to like any part of plan A. I'm just like not letting go. I was like, can we do delayed cord clamping? And the nurse looked at me again, eye roll, and goes, we'll see what we can do. Or we'll see what we'll see what happens. And I was like, not even like just lie, you know, like
Yeah.
just anything but what you're doing,
Yeah.
because you're making me feel terrible when I'm already in just this like such trauma state. I look back now like such a trauma state that I remember in the ambulance thinking, wow, you know, I should feel really scared right now. This is wild, but like I feel completely calm. That I have that meme in my head of the dog sitting in the fire going, this is fine.
Mm-hmm.
You
Mm-hmm.
know,
Mm-hmm.
just survival
Yeah.
techniques taking
Survival,
over.
mama instincts. And you hear a lot about, and we had a home birth transfer. It was a train wreck, right? The word train wreck, I wish it was taken out of anything to do with childbirth.
Yeah.
But the notion that the person who chose to have an out of hospital birth is responsible for a train wreck, or the midwife taking care of that person is responsible for a train wreck. And to be honest, was your situation really a train wreck? Or was it a group of skilled midwives making an assessment that we now need higher care to prevent a train wreck, which is often not honored and completely overlooked?
Yeah, I mean, you have to know when to make that judgment call. And like I said earlier, like they didn't get to me for 2 hours. You know, I looked at Shane and I said, just cut it out of me. I don't care. I need this to end.
And then for the doctor to realize that you were having significant decels.
The look on his face when he read her heart rate was like, oh, yeah, okay, let's get you into just like, oh, whoops. Like, come on, guy. You
Yeah.
know?
And I think the other part of it is, and I feel bad that many providers feel this way, is that I think they're trying in their own way to, and I've heard doctors talk about this, like we get a transfer, we're still trying to allow that client to hold on to plan A. So they put you in a
Yeah.
corner thinking, okay, something's going to happen. Like she's hopefully going to, start dilating a little and the baby's going to come a little lower and let's have a baby. So I think maybe they were trying to give you that opportunity. It's sort of like when someone's having a completely natural delivery in the hospital and then they begin to hemorrhage. And I've seen nurses be like, is she going to be okay with some IV fluids? And they're trying to be completely kind and cognizant of the fact that this person wants very little intervention, but not when we're now facing an emergency. Like we have actually come in an ambulance to the hospital. We're now ready for intervention. And I think that is also, and she was so kind. This one nurse I once worked with was like, I don't know, can you ask her if she's okay with IV fluids? Cause she's having a hemorrhage. And I was like, I looked at the mom. She's like, I'm okay with it. It's like, I'm pretty
Let's
sure
just
she's
fix it.
okay with you managing a hemorrhage, which is again, it's that education. It's the miscommunication.
Yeah, and
Unfortunately.
he also was the only one on call. So he was with other patients, I believe, is what Shane like heard them say or whatever. He was the only one there. So I was like, you couldn't, like, I don't know what's going on with everyone else, but like, you couldn't like come to the laboring mother first. Like, really? There's a baby at stake, you know? But yeah, let me tell you, that epidural was the best thing of my life once it happened. I was like, I didn't even feel the needle going in. That was awesome. But you can still feel them do everything and put you back together. I had to end up getting some morphine because I was squirming on the table a little bit too much because it was just so painful. I feel like no one really talks about like the pain that goes into a C-section. Like, you know, I've maybe just, this is like a new stage of my life and I haven't talked to many people about C-sections, but yeah, I just feel like it's kind of brushed off as like the easy way. And like, that is not the easy way. Like, that was the greatest pain of my life. Like, that was, I mean, the whole 24 hours, but like, you can feel them sewing you back up 7 layers, you know? And I don't know, I just feel like that's not talked about enough.
Well, and epidurals take away, typically a properly placed epidural that is working properly in someone's body for obstetrical purposes takes away pain. It does not take away pressure. So
Right.
you can feel the pull of a needle. Some people have actually said, I felt the pull of the string or the tugging of the skin.
Mm-hmm.
I felt
Yep.
them pulling the baby out, but there's no
Yeah, oh yeah.
pain, which is confusing to the body because it's like, wait, the receptors are like, what is happening here? Absolutely. And which can be traumatic in its own right. But it's rarely talked about that the epidural takes away pain, does not take away pressure. And there can be a tremendous amount of pressure. And in a case like Teddy's where she was lodged, I can
Yeah.
imagine there was quite a bit of tugging going on.
Yeah, and yeah, a lot of time, I was okay feeling her come out because I was like, okay, like at least that's something. If I didn't get to do it vaginally, which, I still am sad about and struggle with, at least I get to feel it in that capacity. And Shane got to cut the cord. I got to kind of like see from like around the corner. I'm getting a little emotional.
Yeah. Yeah.
Yeah, it was really intense, but we had some really sweet moments like in that chaos.
It's probably been a while before you've talked about these or accessed some of these emotions. And with someone who was there, right?
Yeah, amongst all that chaos, those happy moments are what is, activating these tears because at least we got, someone took a picture of us. So we had that picture. That's the only time I ever saw Shane cry. He got all misty-eyed.
Mm.
I do need to mention this one nurse. I think it was two nurses. One nurse, while I was in the ER, was very kind and really saw that I was struggling and helped. And then I have to also just go back and commend Shane because he walked in and saw that I was alone and walked out, and I heard him go, "Where the F is anybody?" And he got and he's the chillest, mellowest dude. And he just like,
Yeah, it's very unshady. Yeah, he became a warrior. Papa Bear.
very Papa Bear. He was showing his true amazing colors. But yeah, this one nurse in the OR said, "Oh, are you having a boy or a girl?" And I said, "I don't know. We're keeping the gender secret, or we're, secret from ourselves."
Yeah.
A surprise, yeah. And she said, "Oh, okay, I'll make sure, let's find out." And she kind of was a little more nurturing. And so when they pulled her out, "Okay, we got blah, blah, blah." She goes, "What is it?" And he goes, "It's a girl." And I said, "Oh my effing God," because that's truly what I felt and truly what I was like hoping for is like, I knew it. I knew she was a girl. So I'm really glad we kept the gender a surprise because even though this was plan X, I got to have that moment too. So we found our moments of joy within that time, which was really nice. And they, gave her to me. Well, I didn't get to do the immediate skin to skin, no delayed, no placenta. I didn't even bother asking because I knew that they were just gonna, do what they did, roll their eyes and shame me. But she took to breastfeeding immediately.
I remember visiting you a couple days later.
Yeah, not to say it was an easy journey, but it was pretty smooth sailing regarding everything else that had happened. But yeah, so she made it. She made it into the world. They got the time of her birth wrong and everything, but around 6:15,
Somewhere around there. Somewhere around
Yeah.
there. And so you came home from the hospital. So typically the way that it works in let's say a non-pandemic situation is that a midwife would have followed you and or come in the ambulance. So we actually advocate for coming in the ambulance because we continue to monitor the baby. And sometimes we even deliver babies in the ambulance because sometimes they're born in the ambulance. And while EMTs can catch babies and cut the cord, they're trained in that. They're not trained in taking out a Doppler and listening to the baby. They don't really, they don't do that. They don't, calling an ambulance for a transfer from an out of hospital setting is for a quick, fast, direct ride to the hospital.
Right.
It's not because you're going to get obstetrical care on the rig. And so in a pandemic situation, the midwife, I see my sound engineer taking deep breaths. It's a lot, right? It's a lot. It's a lot. It's a lot. So in a non-COVID situation, we would go to the hospital with the client. And typically the client goes directly into L&D, where they are taken care of by the obstetrical team. During the pandemic, top was bottom and bottom was top and side to side and all over the place.
Yeah.
So in some hospitals, people just got thrown into the ER until someone could deal with them, which is what happened to you. So you had absolutely no support by your side to tell you what was happening. So your continuity of care was severely disrupted because of the pandemic, which happened to so many people during the pandemic, unfortunately. Now, some people, many people, most people will continue midwifery care after they have their baby in a hospital. So they're like, you know what? Thank you so much. It was great. We had a C-section, we had a vacuum, we had an epidural, we had a little Pitocin, whatever we needed to have a safe delivery. But I'm now going to continue postpartum care with the midwives, which, you know, is natural and is normal. And if midwives need continued collaboration, they will collaborate with the OB to get whatever needs to be resolved, right? But that is within the scope of practice to continue after a hospital birth. Some people are like, you know what? I'm so traumatized that I don't think I can go back, because going back to the birth center or going back to the clinic brings up all sorts of emotions of what my plan A was that didn't happen. And that's honor too. And some people just come back for the 6-week visit to give us a hug and say thank you, or they don't do that at all. And they're like, you know what? That experience was very traumatic for me. Thank you for your care, but I'm not going to continue. So in your particular situation, you continued midwifery care postpartum. And I remember visiting you at home, and you had no appointment to go back to the hospital. So no one had actually told you that your wound needed observation. This is how you take care of a C-section wound. This is what to expect. Very basic post-op instructions.
Yeah. My stay at the hospital was just miserable. The food was, it was insane. It's like they need you to poop, but they're giving you Norco, which will cause constipation, and then they're not feeding you. And then I was in labor for however long and didn't eat for like 2 days. So it was just like, it was wild. And
Constipation can be brutal.
Oh my gosh. Yeah. And they wouldn't let me leave until I went. And I was just like, do I lie? Like, what do I do? But yeah, I finally left, and I had just absolutely no interest in going back there. That is where my trauma lie. Not at the birth center. Being at the birth center when I had my appointments there definitely made me sad, because, you know, of course it was a reminder that like it didn't go my way. It didn't go plan A. You know, I should say that Teddy was perfectly healthy. I was, you know, everything was fine. So
and
that's
super cute to boot.
Oh my gosh, just
cute,
the cutest
cute
little
child.
The cutest little bug.
Mm-hmm.
But I wanted to go, you know, back home in a sense. I wanted to go back to where I had been safe, you know, even though we had to make that call. All of the real trauma was at the hospital. And, you know, I don't think it would have been different even if the OB had been, he was a nice guy. He was funny, whatever. My appointments, I did have to go back to him specifically because my scar ended up getting infected.
Correct.
And like you said, it was very, again, just kind of brushed off. Just keep it clean. You know, it was dissolvable stitches or something, so I didn't have to get anything removed. Yeah, you can shower, just make sure you keep it clean, blah, blah, blah.
And it was during the midwife postpartum visit that your scar was visualized, right?
It's a little red right here. We need to keep an eye on that. And then I think it was like the night after that or something where I woke up just like covered in blood and fluids, basically. I was like, what?
It was essentially an oozing infection.
Yeah, exactly.
At the C-section site. Mm-hmm. Where the skin
Yeah,
had
and
not
it was
approximated or come together was where you were getting infected.
right, and it was deep. And so my current OB that I saw, for my checkup or whatever, said, yeah, it's since it sounds like it was really deep, sometimes some of the bacteria can get caught in caught
In
in
the
there during a
layers.
C-section. The layers, yeah, and I'm like, he should have cleaned it better because that was a whole other level of healing that I was not prepared for. Like, I had to go once a week to go see this OB that was nice enough, I guess, but still, you come back to me when you have another baby. Don't go to the birth center again. And I was like,
As I clean your wound that was caused in a hospital.
yes, exactly. The place that's supposed to be the most sterile. Like, I can't.
Yeah.
It's so
Yeah.
frustrating.
I think I
And
still have pictures of that infection actually.
yeah,
It was not a little thing.
no, I had to syringe hydrogen peroxide in there. This is a little graphic warning, but um, yeah, do a flush with hydrogen peroxide. And then, as far as I could, because I was still kind of numb, put gauze up there to soak everything up. So it was like an intensive
Protocol.
thing.
Hmm.
Yeah. And I have a newborn. And the head kind of came out vaginally, so I'm healing there too. And it just was, I will use the word train wreck in this situation.
Yeah.
Like, it was just so sad. It was just such a bummer, I'll say, because, you have these expectations of yourself, and then you have to also go through layers and layers of, forgiveness of yourself and the situation and, stuff like that. But I remember I was about to take a shower and I was naked and I looked at myself in the mirror and I just was like, wow. And I had just the analogy metaphor, the thought of, you went to battle.
Yeah.
You won the war. Like, you came back. Like, this was a battle you fought. And I just was like,
Wow.
okay, like, really honored the strength of my body, I'll say. Because it looked, oh, and the like the gauzy underwear that they have you wear at the
Yeah.
hospital had my legs like totally broke out in a rash. Luckily it wasn't itchy, so that was a plus. But yeah, I had like rashy legs and this infected scar and just like healing everywhere, and it was just like part of the transformation of becoming a mama. Like, look what we go through for you, we really go through it. It's crazy.
Yeah. Yeah. You're incredible. Talk to me about your healing. Was there guilt? Was there shame? Was there blame? Was there regret?
Oh yeah, all of it. What could I have done? Yeah, I would kind of like watch from outside of myself and go, yep, okay, you're right on track. Like, you're blaming and you're seeing what could have gone better. And
Steps of mourning, right? Steps of loss.
yeah, mourning, exactly. And while I'm in physical pain, not feeling like I'm getting any better, just a very, very emotionally and physically stuck time while you're supposed to be enjoying a newborn, which is amazing and difficult. And you're waking up and you're doing all the things, we co-sleep, so that did make it easier. But yeah, I knew that this was going to be a long journey to get out of this dark place, this sad place. But I know from experience, we all know from experience that time heals. And I just kind of let myself do what I needed to do to move through it. I wouldn't talk about it. I would talk about it. I just let myself just followed my instincts on what was going to make it better. Just followed that light of like, okay, this feels good. I'll do that. And, I was so lucky to have my mom essentially living with us for almost 2 months. And Shane got to stay home from work for like 3 months, 4 months or something. So he didn't have to go back to work for a while. And that was really amazing. So we got some really great time, and my mom was making us food and, taking turns with the baby. So I had amazing support. I had friends dropping off food and coming to say hi, and also respecting our space and stuff like that. So yeah, I always use the word wild when it comes
Yeah.
to motherhood and parenthood,
Good
because it
word.
just
Yeah.
encompasses everything. And, like I said, I went back to you and Michelle because that's what felt good. That was the safe spot for me. So it takes a village. It takes a strong, hardcore village to make things happen, make things move. And, I read a lot of books.
Yeah. 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 What's
So
come to
yeah,
you amidst the healing about your child, your body, your motherhood?
the word that's coming to my mind is control. You have to relinquish control. It is not your life anymore. You are sharing your life with this little human, and this little human has opinions. They form in toddlerhood, but like they start early,
I think they come
and
in with opinions.
I mean, she's true to form to who she was as a baby,
Yeah.
both mentally and physically even. And so, yeah, really having to listen to her in a different way. Just all of your senses. We are superheroes. All of your senses just hone in, if you let them. And it's just, motherhood is just unpacking and layer upon layer upon layer, because, you don't know things until you know things. And so you experience a moment where you go, oh, this is where I need to relinquish control. Okay, now let's dive deeper. Like, what else can I do? Kind of thing. With, fatherhood too. Like, I have to sit back and let him be dad. I'll be sitting there going, that's not the way to do that. Like, you're
Mm-hmm.
never going to get her to do what you want. And then he does it his way and it works. And I'm like, oh, I'm so glad I didn't say anything.
We almost have to relinquish control in areas we didn't know we had areas.
Exactly. Yes. Thank you. Thank you. That's what I'm trying to say.
Yeah, that's exactly right. That's exactly right. And so as she's growing up and you're thinking about her birth, what would you say to a person who's considering birth options?
Easier said than done, but I would really learn how to listen to yourself and honor your instincts and search out what feels good for you. And why, too. Like, does this feel good for me because my friends will judge me if I do it this other way? Or you have to get really deep and real. Yeah, you got to go to those places. And then also, for some, the sticking up for yourself kind of thing and the mama bear roar and protectiveness, like, that comes in waves. At least for me, that's how it's come. It's a learning process. So just go where you feel like you can advocate for yourself the easiest, or maybe where you don't really have to like strongly advocate for yourself, where you're not super questioned. I don't know, kind of a tangent, I guess, but if you're looking for options, go with what feels the most authentic for yourself, the most authentic safety spot, I guess I could say.
And I'm going to ask you a brutal question. What do you say to the person that says, well, you tried a home birth and look how that turned out?
Oh, such a big eye roll. Our bodies are insane. Our bodies change. I mean, most women's menstrual, period is different each month, like, we're not we're not perfect. We change and we morph. And, you know, of course, for the first however long, I was like, absolutely not having another child, not going through that again, like terrifying. And by terrifying, I mean, like, I might have to have another C-section and surgery again. Like, no, thank you. But I've moved out of that. You know, it's still an option, but I'm not scared of the fact. Again, the hospital was where my trauma was. And everything turned out safe and fine. You know, that was amazing. I'm so grateful for that. But to the person who says that, I just do a big eye roll, because no time is the same.
Right.
And I've learned so much more about my body, about pregnancy, about birthing, you know, all of these things that I could, you know, put into practice. I, you know, imagine how another birth scenario might look. And I have, you know, Shane and my mom, and I have my two best friends that I was like, you know what? I wish I would have pushed to have them there. I wish I would have had them be there with me, because, yeah, I think I want my handmaidens. I want my ladies, you know, I want my ladies. I want my coven around me. Yeah, you know, and those are my people, and we're of one mind. And I think if there is a next time, then you know what? Let's go one step further. Let's have a baby at home this time. Let's bring in the gals, you know, like make it a little more renaissance-y, a little more ye old.
I love it. I love it. And this is where really nobody can ever, and I learned this as a young doula, where first, when we were taught that you go to the birth and then you do a postpartum visit, I always thought that at the postpartum visit, I was supposed to talk about the birth. And more, I learned that people are actually not always ready to talk about their birth at a postpartum visit. And if their breast is bleeding and their baby's not feeding and they're worried about their baby, they're actually not going to talk about their birth. They're going to prioritize what is on the table currently. But let's go a step further. When I became a midwife, I had to, and actually first a doula trainer, was really learned that trauma looks different on different people.
Mm-hmm.
And what to me was, oh my goodness, this birth was so traumatic. It was traumatic for everybody involved. I don't know how anyone's ever going to get through this. And then later I see the birthing person and the family, and they have actually framed it in a completely different way. Their body and their mind and their psyche and their soul has embraced it or seen it from a way that I never could, because I'm coming from my lens.
Mm-hmm.
And so not making assumptions about people's trauma is really birth worker 101. Because there are times where people will have this glorious out of hospital birth where literally textbook, nothing could go better. Right? And I will go home and go to sleep and be like, yay, midwife, that was glorious. And then I will come to the postpartum visit and the client is devastated. And I'm like, wait, what? Like, because what is going through their mind and their body, what they may have picked up, something very subtle that may have triggered something else that may have given them a trauma response, I was completely not aware of.
Right.
And so I think I remember just watching you during the postpartum period and even during your labor, like thinking this woman is strong and solid. And I think I remember telling you, like, you're so grounded and you're so present and you're so solid in your wisdom and your constitution. And those are all the things that I think you're going to gift to your daughter. And the bridge for you to meet each other was rocky. It was hard. It was hard. And I remember seeing you and just thinking the infection and the sleeplessness and the fatigue of labor on top of the surgery, on top of mistreatment, on top of plan A becoming plan B. And yet you were holding it all in a container that I could see was heavy, but you were doing it.
Yeah.
And what stinks as a midwife is that I often will see someone at a 6 week or an 8 week visit, and then you go away and I never see you again. And, or I do, or I do if I'm super lucky, like now.
Yeah.
And I actually try to really stay in touch with my clients too. So I'll get pictures of whatever, Jazzy just started college. And I'm like, wait, what? How old am I? Like, I just started college. When did that happen? But things happen and people evolve. And sometimes people triggered trauma later. Like the second birthday comes along and they're like, what just happened? This kid turned 2 and I am now reliving the birth, or I am now reliving the postpartum trauma, or I am now able to finally look down at my C-section scar.
Oof, yeah. C-section scar still bothers me. There's a divot in the middle because of the infection.
Which happens. I mean, it's no one's fault. It's one of the risks of C-section is infection.
Yeah.
Actually, one of the risks of entering a hospital setting is infection.
Yeah.
And when a wound opens, even more so. Right?
Totally.
So what do you do when you look down at it?
Just kind of get a oof feeling. But, like I said, I'm a huge history nerd. So I read a lot about like wars and stuff. And I'm like, I try and put it, trauma in a different frame. I try and, look at more, like from a warrior stance, like this is what happens when you battle for your child, you get scars and that's fine.
That's incredible, Amber. Wow. When are you writing your book?
Oh gosh.
That's what we need is your book. I feel like you're so eloquent. Not only your thoughts are so profound, but the way you put them into the world is like, woof, I never thought of it that way. I'm going to have to go home and think about that.
Oh, wow.
That is that is so true. And Teddy is just so lucky to have you. And as am I, to have had the privilege of being your midwife and watch Shane partner and daddy. And really, I remember I was a brand new grandma when Teddy was born. And I remember watching your mom. And I'm like, wow, this woman's like an amazing mother. She's going to be an amazing grandmother. And it was so inspirational to me because I was such a new grandma at that time, sort of figuring out my daughter's having a baby and how do I midwife and how do I mother and how do I grandmother. And it was just lovely to see your mother do it so beautifully,
Oh, yeah. Yeah. She had to work through a lot too. It was quite a time. She, watching your, the generations, you're watching your baby go through something with their baby. And, it all depends on how you handle things. I am a very slow processor. I compartmentalize. So it's, again, you see me with the heavy box. It's all in a box, but the box is heavy.
Yeah.
And, take things out one at a time.
And sometimes you need a Monica to help you unpack, right?
Sometimes you need a Monica. That's right. And
has there been one book or one resource that has helped you with your healing?
Honestly, it goes back kind of to instincts. I don't listen to too many parenting podcasts. I do listen to some every so often because I just my brain just needs a break, But honestly, actually the thing that comes to mind that has helped has just diving into these books that are, fiction like this Frozen River that help you work through it as a story in a way, if that makes sense. I wonder if I can phrase that differently. You're watching someone else go through a similar parallel. So I'm reading a book about a midwife and, the troubles that, these women are having, and I can think back on my own things, or my own situation. But again, that supportive group, my friends who didn't push to talk about it, just let me come to them. Yeah.
I'm hearing the modality of permission.
Yes.
I feel like giving yourself the permission to unpack when you're ready to unpack. And, I'm completely the opposite. I will pack very heavy and I will unload it immediately, too fast to even remember where I put things. So then I come back and I'm like, wait, where was that? I remember it. Where did I store it? And then it has to come out somewhere else, right? Which is not great either, believe me.
Right.
As someone who, something came to me, I think the book, this is a shout out to Britta Bushnell, who is a fellow birth worker in Los Angeles, who I respect and love. And her book is called Transformed by Birth. And a lot of what you are, and this is just a plug for her. There's no financial exchange going on. But as you talk about the transformation and the story that you have written and are choosing to live, really reminds me a lot of that, because a lot of it is in the story that we carry, and the transformation that happens to us as mothers, and whether the different modes that we go into and the timing of how we go into them is very, very subjective. And I love that you talk about permission.
Yeah.
I love that. That's a new modality for me, is permission, for myself and for my clients. I love it. I just love it. Thank you for midwifing me through that. I love that. Thank you.
Of course.
Thank you. We midwife each other, We really do midwife each other.
I also think to keep talking to each other. I was using Instagram for good, going through all this processing and everything, and seeing other people's stories, other women's stories about, like, oh, I wasn't the only one that happened to, such a simple concept. Validation.
Yeah, which is a lot of what this podcast is about. It's a hopefully no judgment educational place where we can hold those stories and weave them into the fabric without saying that one thread is a wrong color or a wrong consistency or a wrong length or anything. It's one thread in the tapestry.
Yeah.
And thank you for being here with me. I'm so grateful and so honored to be on your journey, and really appreciate your time today.
Of course. Thank you so much for having me. I'm so honored that you thought of me and wanted to bring me along.
Thanks for listening to the Mamatoosa podcast on the Industry Plant Podcast Network. Mamatoosa is hosted by me, Atusa Benji, and produced by Josh Stretton Carlson. Chris Agnew is our audio editor, and our theme music is composed by Mary Lalazarian. If you enjoyed the podcast, please consider leaving us a review and subscribing. See you next Tuesday.